Hi, I'm Tony Gayoso. I'm the founding member and a practicing surgeon at Gayoso Plastic Surgery. A facelift is a procedure that involves making the shape of the face better. It really focuses on the cheeks and the neck, which are really the most common complaints in aging. It helps to create a face that has a smoother jawline, a smoother, more slender neck, and improved shape in the cheeks. It really helps with heaviness around the mouth, or jowling, or loose skin in the neck. A facelift is good for a patient who has issues with shape in the cheeks and the neck. Patients who have sun damage in their skin may be treated with laser or skin care or peeling. Patients who have hollows in the cheeks and the lips may be best treated with fillers or fat injections. But the facelift is good for patients with a lot of looseness in the neck, or looseness that bothers them, or looseness and jowling, or heaviness of the cheeks. A facelift is a very safe procedure. I tell my patients that it's really skin surgery. We're elevating the skin and working right under the skin on tissues that are very accessible. We don't have to go deep into the face. It does take time to do a facelift, but it's not because it's an invasive or difficult procedure. It's just a detailed procedure. I compare it to tailoring a wedding dress. It needs to be done precisely and carefully, and that takes time. Many facelifts can be done on patients who are awake with local anesthetic, and the recovery is similarly straightforward, although there is visible bruising and swelling. I always say that preparing for cosmetic surgery involves planning with your surgeon. You and your surgeon should be able to evaluate your face. I evaluate my patients in front of the mirror and show them what I think can change, and they show me what they think they need changed. That way we're on the same page about what to expect. That, I think, is the most important part of planning. Of course, we want to make sure that the patient's healthy and in good physical condition to undergo the surgery. However, the surgery is not very invasive and it is very well tolerated. Recovery from a facelift often involves hiding from your friends so they don't see your bruising and swelling. For many patients, that's a couple of weeks of hiding. There are some patients who don't mind anybody seeing their bruising, and they can be out and about within a week. So 1 to 2 weeks of hiding, I would say. There is an expectation of roundness and swelling and tightness feeling in the neck and visible scars for the first few weeks or months as things heal. Bruising around the eyes can take more than a couple of weeks to improve. And even though you may be ready to be social in 2 weeks, there's still going to be firmness and numbness in the treated areas that takes several weeks to finally resolve. I don't take a post-op picture of my facelift until they're 6 months out, because it takes that amount of time to really resolve that last bit of firmness and swelling and numbness.